community. And God bless them all.
The cutting of this tape symbolizes the official handover of this primary health care center, which was renovated by the European Union to the federal government. The project is part of the EU's pledge of over 100 million euros, also called the EU Sign project, to assist the federal government strengthen primary health care services and reduce maternal and child mortality.
European Union support.
The Minister of State for Health describes the gesture as a major boost towards achieving the government's goal for universal health coverage.
These projects take us several steps forward in our quest to provide essential health and medical services to all Nigerians in the President's universal health care agenda. As we know, primary health care extended to both rural and urban areas is the backbone of that initiative.
With a record of 69.4 deaths per 1,000 live births, Nigeria remains a major contributor to the global infant mortality and morbidity ratio, and the government's target of reducing this figure by the year 2020 can only be achieved through an efficient primary health care system.
Efforts to increase capacities in the health centers will amount to little if there are no sustained supply of the potent vaccines to give children, mothers, and avoiding problems of stock out at all levels.
The intervention of the EU Sign project around renovation and construction of primary healthcare services, providing cold chain materials, equipment for our vaccines, are really exactly what we need to ensure that Nigerians everywhere have access to safe and potent vaccines.
Funding for healthcare in Nigeria remains among the lowest in Africa, as only 4.13% of the total annual budget for 2016 was allocated to the sector. This is a far cry from countries like Rwanda, Botswana, Zambia, and Burkina Faso, whose health budget averaged 15% of their annual national budget. Health activists are attributing the nation's weak and seemingly non-existing primary health care system to poor financing.